Hi guys, welcome to my channel. My name is Lolita, and in today's video I am going to reveal to you how much a PACU nurse really makes. So what is a PACU nurse? A PACU nurse is a post-anesthesia care unit who works in that department and takes care of patients coming out of surgery under general anesthesia. And so the PACU nurse helps that patient wakes up. If they have any pain, they give them pain medications. But to be a PACU nurse, a lot of times, at least all the PACU departments that I have worked at, you need at least 1 year of experience from critical care. Today I am going to share with you the pay scale from between UCLA and UC San Francisco hospitals. I will add the link down in the description box so you can go and check that out. First, I want to talk about how much a new grad makes from UCLA. A new grad is someone who just graduated out of nursing school, and a new grad at UCLA makes per hourly $50.01. UCSF San Francisco, a new grad with less than 6 months of experience who is considered a clinical 1, that nurse will make $72.56 per hour. Per pay period in a span of 2 weeks if the nurse works 12-hour shifts, which is three shifts a week, and per pay period, that's 6 shifts. The new grad at UCLA will have a paycheck, or gross paycheck of $3,600 versus San Francisco $5,224. In a month, the new grad from UCLA will be making $7,200 versus San Francisco $10,448. That is a huge difference of more than $3,000 a month. But as a PACU nurse, if you have at least 1 year of critical care experience, you are considered a clinical nurse tier 3 at the UC system. And that nurse at UCLA makes $53.42 per hour. And in San Francisco, that nurse makes $76.17 hourly. Then you have to factor in your call hours, your call pay, and what that means is when you take a call shift, meaning that you're on standby because surgeries can happen any time of the day 24/7, so somebody has to be on standby just in case there are emergency surgeries and the hospital has to call you in. Anyway, so a call pay per hour at UCLA makes $12 an hour, which is kind of like the standard call pay in California. And at UCSF, get this, this is pretty amazing. They make 50% of their hourly wage. So if you are a nurse with 1 year experience and you're considered clinical nurse tier 3, you are making $38 per hour while on standby, and you're just kind of waiting around. So hourly rate, you are making $38 an hour, and if you don't get called in and you're on a 12-hour call shift, you will be making $457 for that shift of not even going to work, just, staying at home. And on top of that, I know that in Palo Alto at Stanford Hospital, the nurses there just got a 17% raise, which is huge. There you have it. Those are the pay rates between UCLA and UCSF. Really good money up there in Northern California. So check that out. All right, well, thank you so much for tuning in. Until next time, I can't wait to share more videos with you all. Oh, and I forgot to mention that if you're on standby at home or you're on your call shift, and if the hospital calls you in for an emergency surgery, you do get paid time and a half for going in. And a lot of times you also get paid an hour of your drive to the hospital. If you are working for UCLA and you got called in to work, you're on standby and you get called in, you will be making $80.13 versus at UCSF you will be making $114 while you are at the hospital. And a lot of times when these emergency surgeries happen, they are truly emergencies, and sometimes you're in the hospital for, I don't know, however long the surgery takes. So you multiply those hours by your hourly rate. So in San Francisco, if you're making $114 and you clocked in, from the time you clocked in and clock out, you're in the hospital for 6 to 8 hours, you just made $1,000. So for me, if I was living in San Francisco and I've been a nurse for over 10 years and less than 15, I will be making, I think I'm considered CLIN 3 still, or CLIN 4, $102 an hour. Holy moly, that is a ton of money as a nurse, $100 per hour plus call pay. So that means it's $50 an hour while you're at home, waiting around, waiting for that phone to ring. And then when you go into the hospital, you will be making $150 an hour. That's like more than what some doctors make. That is insane. Oh my gosh. Oh my gosh. Anyway, thank you so much for watching my video. Until next time. Bye.